Hi everyone, this is Dr. Cole Handy Jones here with your handy physical therapy tip of the day. Today I want to talk about arthritis, and I want to talk specifically about if you have arthritis, do you have to have surgery to fix it or not? Before we get too far, don't forget to hit the subscribe button, hit the like button, and put a comment down below. I get back to every comment of someone who asks me a question. So let's get started. Okay, I want to give you a scenario. You've gone to visit your physician or another healthcare provider. They did an x-ray of perhaps your knee and your hip, and they've told you that it's bone on bone. And the only way to fix it is to get surgery. Is that really true? I'm here to tell you no. There are so many ways that you can fix your pain and your function that's associated with your arthritis without getting surgery. If you live life on earth long enough, you will have arthritis somewhere in your body. That arthritis most normally occurs in our big load and weight-bearing joints in the body, mainly our knee and our hip, perhaps also though in your back or your neck or maybe even a shoulder. Today I'm mostly going to talk about knee and hip arthritis since that's the most applicable and usually the most common one, but these scenarios can be applicable across the whole body, anywhere you really have arthritis. I want to show you a couple kind of shocking statistics that you might find surprising that I researched as I was looking at some different literature, okay? Some of this says arthritis limits the activity of approximately 25 million US adults right now. Around 44% of adults with doctor-diagnosed arthritis had arthritis attributable activity limitations in 2015. The reason I think this one is so important is because it's saying that arthritis is limiting your activities or the events and things that you want to do to live life and have fun and be enjoyable. This also says that adults with arthritis were about 2.5 times more likely to have 2 or more falls and to suffer an injury in the past 12 months compared to people without a fall. That's a big deal. I'm sure that you know, and if you don't know, if you fall as an adult, it can have huge implications from breaking a hip to cracking your head open to other kind of things. So if you have arthritis, it means you're more likely to have a fall, and that's a big deal. It also says in 2013, the national cost of arthritis were approximately $304 billion. I'll repeat, the cost of arthritis in the US, this was in 2013, was $304 billion. Guys, it is a pandemic right now. We need to find ways to fix this. One more that I think is really important. This was back in 2010 and 11, but there were approximately 500,000 hip replacements and about 500,000 knee replacements. And I'm sure you know that every year that number grows. Guys, there's a time and a place for a knee and a hip replacement. There is. I'm not one to say that you should never ever go down that route, but if you haven't exhausted every conservative mean necessary, don't do it. You cannot undo a surgery. So what I'm going to talk about today is a few more things of what you can do to use some conservative means to fix your knee or hip arthritis pains and functional limitations on your own without having to undergo surgery. Before we get into how we can fix this problem, I wanted to talk a little more about what this problem is and how it comes to be. So I'm talking about osteoarthritis. Let me kind of break down that word. Osteo means bone, arth means joint, and itis means inflammation. So it's inflammation within the joint of a bony tissue, so knee or hip, okay? What happens is we normally have cartilage that gives a little bit of a shock absorption in that joint. Well, over time, and it's usually not just from wear and tear, it's usually from abnormal forces and torques going through that joint, there's excessive inflammation, which starts to kill and destroy that cartilage. So you take a joint that should be kind of healthy and separated. Okay, picture this as being two bones, there's space between them, and over time that joint becomes more narrow and narrow and narrow. I'll put a picture up on the screen somewhere, maybe here or here or here, but you can see on one side, you can see a really healthy joint, okay? One that has smooth surfaces, space between the joint, that's gonna look and feel really good. On the other side here, you see a joint that's very arthritic, changed. It's got less space, it's got bone spurs, the cartilage is being worn out. You can imagine that can be very uncomfortable and problematic in the long term, okay? The question is, why did it become like that? And what can we do to fix it without undergoing surgery? So let's talk about that right now. First and foremost, I always tell my patients I cannot change your arthritis. I can't do that. But what I can do is I can change how you move around that joint that's arthritic, and how you control that joint that's arthritic, and also change your movement patterns so you don't have as much pain, swelling, inflammation, and you can move more normally. Okay, so I'm going to talk about 5 things that we can do to fix this problem. First and foremost, range of motion or mobility. Okay, a joint that is arthritic becomes really stiff. It doesn't want to move. Okay, if you have a knee or a hip that's arthritic right now, when you try to move it, it's probably painful. It probably doesn't want to move very far, and it probably feels really full. Okay, so the first thing that we can do, we can teach you hands-on techniques, but especially exercise that you can do on your own to start to loosen up that joint and get it moving more normally. You can imagine a more normal moving joint is going to feel much better, and you're going to function better. Instead of when you're reaching down to put your socks on your foot and you can't get to your foot, if we can get that knee bending more normally, you'll be able to put your sock on. When you're trying to go up and down stairs and you just can't lift your leg quite high enough to get up there, we can do things to get your hip moving more normally so you can actually lift your foot up and get it on a stair and things like that. So the first thing that we can work on and fix is range of motion. The second thing that we can do is strengthen the joint and the key muscles that support the joint, okay? Remember our analogy when we have our bone that's separated, but now it's bone on bone. You can imagine there's lots of friction and grinding and discomfort that occurs with that, okay? If we can strengthen the key muscles that support the joint, there'll be less of that grinding and it'll be better controlled, okay? If we can do that, it's gonna lead to a lot less pain from the friction and also more function. So once again, if you're having a hard time doing something like stairs, let's see, because of knee pain, you probably stopped moving normally. Well, if we can strengthen that joint appropriately, not only will we control the friction-related pain, but then you can do something like a stair. That is so important to have your quadricep strength and hip and butt muscle strength to do that appropriately. Okay, so the second thing that we can work on and fix is strength. The third thing that we can work on is balance. If you're getting older, no doubt you're starting to notice changes in your balance, especially if you have arthritis. If you remember my statistic from the beginning, I said that if you have arthritis, you're more at risk for falls. Well, we can work on and change your balance. So once again, if we can change how you balance, we change how you control your joints, we change how you move, which leads to less pain and more function. So the third thing that we can do to fix this problem is work on your balance. The fourth thing that we can do to work on this is we can change and improve your posture. Our bodies are great at surviving. They adapt and change so that we can do whatever we can to survive. Unfortunately, because of that, when we start to have a problem on our body, we start to move differently. Our postures change to try to find a way to not have pain and to still function. Well, to a certain degree in the short term, that's okay. But in the long term, if we continue to have poor postures and poor movement patterns, we're going to have even more pain and more problem. If we can do things to change your posture, it will put your joints in better position to accept gravity and load, which will lead once again to less pain and more function. So that's number 4, is we can change how you are moving and your posture. The 5th, and perhaps the most important thing that you need to do, is find and determine the underlying cause of this condition. As I said, if you've been told your arthritis comes on simply from wear and tear and old age, to a certain degree that might be true, but that's not everything. Look at your friend right next door who might be the exact same age but doesn't have arthritis or the same pain you do. Let's say it's your right knee. Well, why does your right knee have a problem and not your left? There is a reason, there's an underlying cause that could be contributing to that, okay? For example, with the knee. I often find that if someone has hip mobility limitations, meaning your hip doesn't want to move normally, then you have more knee problems, okay? Our body is all connected like a chain. If we don't move well at our hip, our knee will take the brunt of the force and we'll have more arthritis, degeneration, and problems, okay? Same thing goes for the hip. If I have a hip problem, well, why is it on one side and not the other? Why do I have a hip problem but someone my same exact age doesn't, okay? Lots of times if we have a back issue that we can't control our lumbopelvic girdle, that's our low back and the joints going on there, then all that force and torque and issues will start going through our hip, which can lead to arthritis and pain. So the fifth and most important thing we need to determine is to fix the underlying cause of your problem. I hope you found something helpful in this video and found hope that if you do have arthritis and have been told the only option is surgery, that's not true. I'm going to put out a video series over the next month or so about different common arthritic conditions that I see and how you can start to treat and fix them at home. It is possible. If you found something that you liked, please hit the subscribe button, hit the thumbs up, put a comment or a question down below. I'll get back to you as soon as I can. My question of the day: if you've been told that you have an arthritic condition, what have you done to get it better without having to undergo surgery? Thanks so much. If you've been told that you have an arthritic condition, look forward to more videos that will get you moving and feeling like my 4-year-old right here again.